Thank you. We'll have a short agenda today. We have one ordinance. And Madam Clerk, would you read that, please?
That item is 110865, accepting and approving a 1-year, $89,803 contract with Missouri Department of Health and Senior Services that provides funding for childhood lead poisoning prevention program and increasing revenue and appropriations in the amount of $3,813.
You may start your presentation.
Thank you, Madam Chair, members of the committee. I am Bert Malone, manager of the Division of Environmental Health Services for the Kansas City, Missouri Health Department. With me today is Amy Roberts, who is our nurse case manager. And we had the fortune to be before this committee back a couple months ago when we were talking about our lead hazard reduction grant that we have from the federal government, the Department of Housing and Urban Development. Today we're before you to bring before you this ordinance that allows us to accept increased funding from the Department of Health and Senior Services, particularly to do lead case management of individuals that are indeed impacted by an elevated blood lead. The children in our community that have been exposed, our nurses and our staff work with them in doing continuous risk assessment and case management of those individuals to assure they get the therapy that they need and the case management services that they need. So I've asked Amy if she would to just do a very brief presentation for you about what it is that our nurse case managers do and how we're involved in the lives of the children that we serve.
Okay.
Thank you. Good evening or good afternoon, everyone. I'm Amy Roberts, the program manager for the Kansas City Health Department Lead Poisoning Prevention Program. This CDC grant funding that we're requesting to accept is part of the funding, as Bert said, for providing case management to lead-poisoned children. And to show how case management works in our program, I'm going to talk about one of our patients. This is a 22-month-old little boy named Keaton. And to show how lead poisoning affected Keaton's brain, I'm going to use this as a model. And this is a healthy baby's brain.
Those aren't hot tamales.
This is the brain. This is the baby's
He's
brain.
looking at that candy, I think.
And when a child is exposed to lead, the lead causes permanent damage to the brain. And case management and its intervention can help decrease the damage to the brain and improve the outcomes for the baby. So when Keaton was just diagnosed, his lead level was 49 micrograms per deciliter. And the current definition of lead poisoning is any level over 10 micrograms per deciliter. And when the nurse went to the home, she found a diaper-clad little rascally toddler playing in a dirt front yard. And there was chipping paint in the windows in the living room. And the family had recently replaced floor tiles in their living room and stirred up a lot of contaminated dust. The family also had a dirt floor in the basement. And when the mom would go down to do the laundry, the kids would follow her down there. And they had lead paint in the basement, and then the lead had contaminated the dirt floor as well. In addition, Keaton was chewing on some vinyl mini blinds that were contaminated with lead that were in the living room. On examination, the nurse noted that Keaton had a developmental delay. He had delayed speech, and he was also hyperactive. His lead level was high enough to warrant treatment with medication, but he couldn't be treated until we could guarantee that he was away from lead paint hazards, because you can't give the oral medication when there's hazards in the child's home. The nurse and the inspector worked with the landlord and were able to arrange to have the family relocated to another home for about a month for free. The CLIP program staff, that's the lead poisoning prevention program staff, visited the home twice to help the mom paint and scrub floors and clean out windows to help decrease some of those lead paint hazards. In addition, our Housing and Urban Development Lead Hazard Control Grant paid for a contractor to come in and do more extensive painting and seal the floors and the stairs and put a new floor in the basement and cover the bare soil in the front yard. The nurse also arranged for a referral for speech therapy for Keaton and early childhood special education services through Head Start. She also arranged for LIHEAP, which is a funding resource agency, LIHEAP, to help the mom pay her utilities, because when they were relocated, she had to pay utilities in both places, their current house and then the one they were relocated to for a month. The nurse also tested the other two children that were in a home, a 4-year-old girl and a 6-month-old baby, both of whom were found to have serious lead poisoning. And she set the baby up with referrals for speech therapy, special education, and occupational therapy. And the 4-year-old required some early intervention at school. And after 2 years of interventions and monitoring, Keaton's lead level had decreased and his case was closed. And he still shows some delays, but is improving. And this brief case study was to talk about the dangers of lead poisoning and illustrate the redemptive effects of case management. And we're pleased to have CDC funding to put towards these efforts. Thanks very much.
Say anything else?
No, I think that we simply wanted to demonstrate the effectiveness of case management and illustrate how that can impact a child's life.
It really makes a difference. Is there, the children are required to have certain immunizations before they start school. Lead testing isn't one of them, is it?
It is. Before a child enters child care.
Oh, child care.
So even daycare. And actually, there's a section for lead for them to write down when they were tested and what the result was on the immunization card.
So do they just test it through blood samples?
Yes. Yeah, it's a finger prick.
Oh, okay, so that's not. And then how much, you said they went to a couple of agencies to help get their home lead free. What is the monetary amount? Is there a limit, like several thousand that can be funded for lead to make the home safe or lead free?
It depends on the agency. Okay. Our current lead hazard control grant from Housing and Urban Development, it also depends on the situation in the home. If there's multiple children in the home, if the home's being used as a daycare, it kind of depends on where the hazards are, which ones are located. I mean, we are required to remove the hazards that are the areas that are hazardous for the children. So wherever kids can reach, wherever they're going to be living or spending the majority of their time, those are the hazards that get first priority.
Our average hazard remediation in a home, the contracts generally run between $7,000 and $10,000, sometimes perhaps more, sometimes perhaps less, but most times around the $10,000 mark.
About that much.
Okay. Thank you. Anybody on the committee have questions?
Yes, thank you, Madam Chair. 2 questions. For this contract of $89,000 or almost $90,000, just to give an idea, how many children do you or cases will you be able to work with that amount? And I'm sure there's probably a range to it, but out of curiosity, how many?
Well, that's a great question. We provide case management, comprehensive case management, which includes an inspection for lead hazards and nurse case management to children who have lead poisoning levels over 15 or 15 or higher. And we manage around 50 to 60 per year. Our caseload depends on how many children get tested and how many of those children are high. Mm-hmm. So we will provide case management to all the children that need testing or all the children that require it within the Kansas City limits.
Okay. And then the other question, which honestly is probably beyond your purview, but I'll ask it just to see, is there, or I'll ask it this way, what is the responsibility of the building owner, the person who is renting the home? Because what I've heard are the kind of things that obviously will take care of the family's need, but it's also, I mean, it's a boon to the person with the property. They now have an improved property. So what is their obligation, I guess is my question, to those that they're renting to?
That's a great question. You mean in terms of our providing services or in terms of removing hazards?
I guess probably more of removing the hazards, because in your case with Keaton, Yeah, that family moved out for a time. They're coming back, but now it's repainted. There's a floor in there now. I mean, these are all things that will stay with the property after that family leaves. And so I'm just sort of curious what's the downside, I guess, to a property owner who may know they've got lead in their property, who now may get an improvement that carries with the property. Is there? Yeah, I'll stop there. Yeah,
that's a great question. And our local lead ordinance requires that hazards be removed by the property owner. So once the hazards are identified, the owner is responsible for removing those hazards. Sometimes owners that have suspected that they have hazards will ask us, will sign up for our program, and we'll come and we'll do an inspection and identify hazards, and then fix the hazards, and then the owner is required to disclose that information. Mm-hmm. It is kind of a win-win because they realize how they can learn how they can protect their people who are renting their properties, mm-hmm. And then they also get that home improvement. So the owner is responsible whether or not we fix it, or whether they do it themselves, and they have the option of doing it themselves.
Okay.
Does lead poisoning have a more devastating effect on the younger people, younger age than older?
Yes, it can affect anybody at any age,
Sure.
and so you'll see effects at any age. But because little ones' brains are growing so much faster, mm-hmm. And they have smaller bodies, and they absorb more lead, and some of their organs aren't working as well as an adult. That will also help them absorb more lead. So we see the most devastating effects, pregnant moms, so babies, unborn babies, and really young children.
We also shared with you, I believe, an article from the city of Cincinnati that outlines perhaps significantly the long-term consequences of lead contamination, which links lead exposure and lead poisoning to increases in developmental delays, which result in dropping out of school, which results in higher absenteeism, obviously, before the dropping out, finally increased crime and delinquency and increased social consequences as a result of something that could be identified early, right, and with effective case early management, mm-hmm. Modified. And so we believe, obviously, and this study that was done in Cincinnati demonstrates that there's clearly a link between lead poisoning and increased juvenile delinquency and crime.
It reminds me, if I may, and I go back to your example with Keaton, how you threw the hot tamales back in after some interventions occurred. Mm-hmm. What is that recovery time, or if you can even quantify that, between removing that lead influence and then kind of that restoration of those various brain functions?
It's very child dependent. It depends on how much lead the child's gotten into his body, and is he still getting more. Oh. So first thing we need to do is identify if there's any there, and then stop the exposure, and then look at ways to improve the brain function. Once the damage occurs, you can't change the damage, but you can improve other portions of the brain that will take over, and the time itself, it kind of depends. The earlier the better, absolutely, as it always is with young children. The more early intervention you can have, the better they're going to do when they get in school.
Thank you.
Anybody else have
How many staff people do we have for this, that this grant will help pay for to facilitate this?
Currently, there's 2.
Okay.
Our lead poisoning prevention funding from the health levy also pays for staff, and our HUD lead hazard control grant also pays for staff.
Good. Well, I just also want to say that the example of Keaton and the jar of the brain was really, really good. I believe it really reflects how this protects the health of our children and women in our city, and from lead. And the example, the scenario, very excellent. So,
Thank you.
Thanks for sharing.
Thank you.
Any more comments or questions? Anyone from the audience? Is there anyone in the audience? Okay, may I have a motion, please?
Madam Chair, I move that ordinance number Yeah, 110865 be passed out of this committee to the full council with recommendation of advance and due pass.
Second.
It has been moved and seconded that ordinance number 110865 be voted out of this committee with recommendation of due pass